Welcome to our podcast session. Today we're diving into the details of a well-known antibiotic, azithromycin, its uses, and all the key instructions around it.
I'm eager to unpack this. So, azithromycin, right? It's prescribed for a variety of bacterial infections?
Yeah, exactly. It's used for bronchitis, pneumonia, and even for sexually transmitted infections and certain ear, lung, skin, and throat infections. It's pretty versatile.
And isn't it also used in more unique scenarios like preventing disseminated Mycobacterium avium complex infections?
Absolutely. It's one of those antibiotics in the macrolide family that stops bacterial growth. But important to note, it's not effective against viruses like the common cold or the flu.
Right.
You definitely don't want it misused.
So its mechanism is more about halting the bacteria rather than outright killing them instantly, correct?
Yeah, it's like it essentially tells the bacteria, hey, stop growing, instead of slamming a knockout punch. It really underlines how targeted the approach is.
Now, when we talk about using azithromycin, there's a range of formulations. Can you break that down?
Sure, there are tablets, a regular suspension, and an extended release suspension. The tablets and suspension are taken once a day, usually with or without food, for anywhere from 1 to 5 days. And in cases like preventing MAC infection, sometimes once weekly. It really depends on the situation.
And the extended release version, that's a one-time dose on an empty stomach, right?
Exactly. It's designed to be a one-shot approach. But then you've got specific instructions, like shaking the liquid well, using a precise measuring spoon or cup, and even mixing in water if you're using the powder version.
Right.
Every little step is crucial.
Speaking of those details, the instructions mention mixing a 1-gram packet with 1/4 cup of water, then an additional 1/4 cup afterward, ensuring you get the full dose. It almost sounds like a mini chemistry experiment.
Yeah, it does, doesn't it? It's kind of like making a very specific recipe where every bit matters. If you mess up, you might not get the full effect, which could leave the infection partially treated. Precision is key here.
And I noticed there's a warning. If you vomit within an hour, you need to call your doctor. That's pretty strict. Could you elaborate on why that is important?
Sure. Vomiting soon after taking the medication means the body might not have absorbed enough of it, so the infection might not be fully tackled. It's really about ensuring the full dose is delivered inside your system, so no shortcuts.
Right. Now, what about the side effects? The list seems quite extensive, from nausea to potential heart issues.
Yes, azithromycin can cause a range of side effects, some more common like nausea, diarrhea, or headache, and others that are more serious, like arrhythmia or rash. It's definitely one of those medications where if severe symptoms occur, you need to contact a doctor promptly. You got to be very mindful of your body's reactions.
I also noted there's a caution regarding allergies. It seems important to inform your doctor if you've had reactions not just to azithromycin, but related antibiotics like clarithromycin or erythromycin.
Exactly, that's a big one. The medication can trigger a serious allergic reaction in some folks, so it's critical that your doctor knows your full history, including any reactions to similar drugs. That sort of pre-screening can really avert risks.
Here's a question. Some might think skipping a dose once in a while isn't a big deal, but what does the guidance say about that?
Well, the advice is pretty clear. If you miss a dose, take it as soon as you remember, unless it's nearly time for your next dose. And never double up to make up for it. It's like you don't want to overwhelm your system with an extra dose, right? Consistency is key for antibiotic efficacy.
On the storage side, they mention keeping the medication in its original container, away from children, and even specific storage conditions. For instance, no refrigerating the extended release suspension.
Exactly. They really stress safety, both in terms of keeping the medication effective and preventing accidental ingestion by kids. Proper disposal is also highlighted. Don't just flush it, but use a take-back program instead. It prevents environmental issues too.
And if someone accidentally overdoses, there's a clear protocol to call poison control or emergency services immediately.
Yep, that's a critical safety net. The instructions even provide the hotline number, 1-800-222-1222, and advise calling 911 if there are severe symptoms like seizures, difficulty breathing, or collapsing.
Right.
Time is of the essence in such cases.
I find it interesting how the document not only addresses the practical administration of the drug, but also contextualizes how misusing antibiotics can lead to resistance. That's a broader public health message, isn't it?
Absolutely, that's a great point. It's like a reminder that using antibiotics when they aren't needed can backfire big time, making infections harder to treat later on. It's a bit of a public service announcement wrapped into a medication guide. Really emphasizes responsible use.
Now, I do want to offer a respectful challenge here. Sometimes these detailed instructions, like measuring mixing liquids and specific storage conditions, might seem overwhelming for some patients. Don't you think it could potentially lead to non-compliance, especially in busy households?
That's a fair critique. The level of detail is high, and for some it could be confusing. On the flip side, the clarity is intended to prevent errors and ensure effectiveness. It all comes down to clear communication from the prescribing doctor or pharmacist, kind of like having a thorough tutorial before diving into a complex recipe. That makes sense.
And how about the role of patient education here? It seems crucial that patients get a copy of the manufacturer's information or proper counseling on how to use the drug.
Absolutely. Being informed about the medication, knowing precisely when to take it, what to do if you miss a dose, how to store it, and what to do if you experience side effects is really critical. This kind of detailed guidance can bridge the gap between a prescription and effective treatment. It's like an instruction manual for your health.
It also strikes me that there's a lot of emphasis on interacting with your healthcare providers for lab tests, discussions about your overall medications, and reporting any unusual side effects.
Exactly. It's a two-way street. The medication works best when the patient, the doctor, and sometimes even the pharmacist are on the same page. One person can't do it all alone. It's a team effort.
Teamwork indeed. And while we're on that note, it really highlights the importance of keeping a record of all the medicines you're taking, right? Especially since drug interactions are a serious concern.
Yep, a medication log can be life-saving. When you combine prescriptions, over-the-counter meds, vitamins, and supplements, it's all about making sure nothing clashes in harmful ways. It's a bit like managing a complex itinerary for your body's health. Organization is key.
I guess what we're really looking at is a comprehensive approach to patient safety, right down to safe disposal practices.
Exactly. It's not just about taking the drug, but ensuring that once it's used, the leftovers aren't harming anyone or anything else.
Right.
Proper disposal, secure storage, small details with big impacts.
And to circle back, it's so important to recognize that azithromycin's effectiveness strongly depends on following these guidelines to the letter. No improvisations when it comes to dosing and administration.
Precisely. Deviating from the prescribed regimen can not only reduce effectiveness, but can contribute to antibiotic resistance. And believe me, that's a huge problem in modern medicine. Absolutely.
So, in summary, azithromycin is a powerful tool when used correctly. It treats a variety of bacterial infections, requires careful adherence to dosing instructions, and mandates communication with healthcare providers to manage side effects and ensure proper usage.
Exactly. It's a prime example of how detailed guidance and responsible use can lead to effective treatment. And while the instructions can seem a bit intense, they're designed that way to maximize safety and treatment success.
Right.
Details matter.
This has been super enlightening. Thanks for breaking down each aspect with such clarity, even as we navigated through the finer points of dosages, side effects, and patient instructions.
Anytime. It's all about ensuring everyone gets the most from their treatment while keeping the risks minimal. Knowledge is power when it comes to medicines.
And thanks to clear resources like Medline Plus, patients can get reliable, government-backed information. That's reassuring.
Absolutely, it's a great resource to turn to, and trustworthy information is key in healthcare, especially when lives are involved.
Well, I think we've covered the essentials of azithromycin, from its prescribed uses and proper administration to the reasons behind its detailed guidelines.
Yep, that wraps it up nicely. Remember, always follow your healthcare provider's instructions And if something seems unclear, don't hesitate to ask.
Right on.
Questions can only lead to safer outcomes.
Thanks for joining me in this deep dive. Till next time, stay informed and stay safe.